Let's get this organized. Hello, my name is Dr. Phil Boyle. I am a fertility doctor from Dublin, Ireland, and I want to share with you our new publication regarding our practice success rates compared to in vitro fertilization. The techniques that we use are restorative reproductive medicine using our particular approach with neofertility, and it's just been published today, the 17th of September 2025. It's in the Journal of Restorative Reproductive Medicine, and the link is here. If you Google my name and restorative reproductive medicine outcomes, I'm sure you'll find it. Restorative reproductive medicine is where a couple conceive through a loving embrace combined with multifactorial investigations, diagnoses and treatment, allowing them to conceive together over a process of 12 cycles, whereas in vitro fertilization, as you probably know, is fertilization in the lab, where the embryo is produced through a scientific intervention and transferred after conception and growth for a couple of days. We work very much with a fertility chart. This is our guide to our investigations and treatment. Obviously, couples prefer to conceive naturally if they can at all, but we often find fertility clinics tend to prefer in vitro fertilization. Historically, IVF was considered as a reasonable intervention after all attempts at natural conception have been exhausted, but more and more we find that couples are doing IVF when a restorative approach is still a strong option. So we wanted to ask that question by looking at our practice data. Remember, IVF doesn't solve the problem. It's expensive, it's invasive, with modest success rates, and of course there's ethical concerns, especially surrounding the embryos. With restorative reproductive medicine, while we have a multifactorial restorative medical approach, the philosophy is relax. It's normal to take a year to conceive. You have time. Find the problem and fix the problem, and then give it time. When the pressure is off, you're more likely to conceive. By contrast, I commonly find there's a degree of panic with the IVF approach that you got to do this quickly, your fertility's falling off a cliff, you have to try immediately. So I often find that sense with couples that I would speak to, and they're often wondering, what do I do? I really want a baby. Do I have to go for IVF straight away, or can we continue to try naturally? Remember, no approach is guaranteed, and I often spend a significant amount of time explaining, here's what we do, and here's what the percentages are. I hope it'll work, and then you have to decide, and here's what IVF is, here's where we are, so you can decide. Our objective was to compare our outcomes with in vitro fertilization outcomes in 2019. We compared our data with official published data from the HFEA in the UK, CDC and SART in the US. And these are our results. For everybody we treated, we had an overall 41% live birth rate compared to just 24% in the UK and a much higher 37% in the US. Our twin pregnancy rate is nice and low at 2.5% compared to 6 and 7% for the IVF registries. Our premature birth rate is less than half of the only one that was reported from the US. And that's good news for couples trying to have babies. Fewer twins, lower incidence of premature delivery, really important. And we seem to have a comparable success rate. Very premature, nobody. And we don't have the data to compare with IVF because it hasn't been released. Our birth weights were 7 pounds 9 ounces, so 3.422 kilos, and birth gestation normally 39 weeks, so mostly full term, normal weight, and generally healthy mum, healthy baby. So uncommon for us to see early delivery. We really need to know the data from our IVF colleagues, and that data was not available to us. So if we compare the graphs, there's the overall numbers. We broke it down a little bit, and we said, well, if we only look at those that are under 43, so up to and including 42, you could see the way it breaks down for the different ages. And the green bar represents the RRM, our clinic's live birth rate, compared to the blue bars for in vitro fertilization, and it appears to be significantly higher. So certainly in Ireland and the UK, I can say persisting for 12 cycles with a restorative approach makes a lot of sense, because we can give you apparently a higher success rate compared to a single cycle of IVF. In the United States, it's a little bit different because they seem to have much higher live birth rate, and we're comparable. And we would, this is looking at everybody up to and including age 40, and we had a 44% overall live birth rate compared to 41%, and that's not statistically significantly different, it's comparable. So we can get a good live birth rate, mostly full-term normal weight babies, low incidence of twins, low incidence of premature birth. Our multifactorial diagnoses are really interesting because we hardly have anybody with unexplained infertility. We have a high frequency of suboptimal hormones, whether it's poor follicle function or corpus luteum insufficiency. We've 20% we treated had male factor, and we feel that endometriosis is often underdiagnosed outside of our practice, where only 7% of those going for in vitro fertilization had IVF, where we would find it for at least 25%. So there's some of the interesting, significant differences. The treatment strategies, there's about 22 different interventions that we can potentially recommend, and that's the list of them. So it's not just, and you tailor to each individual. Well, for the couple that I have, based on their overall picture, what do I think this individual needs? There are limitations. This is retrospective analysis, small numbers, and we don't have the IVF prognostic data to make solid comparisons. We need larger numbers, and we need prospective comparison to make more firm conclusions. But it is useful as a benchmark to say a restorative approach is a very reasonable thing to try. So remember, our multifactorial restorative needs to be conducted over 12 to get 12 good cycles, and we compare just one cycle of IVF. It's true, if you do repeated cycles of IVF, you'll get higher live birth rates, but also at a significantly higher cost as well. We're looking per patient that we treated, whereas IVF is looking per treatment cycles, and we don't know individual patient outcomes from the data the way it was presented. This is a pyramid of the level of evidence. You can see we're low down on that pyramid, and our goal is that's because it's a retrospective review. If we can move this to a prospective study, then it'll move way up the pyramid of evidence. So we admit, yes, this is low level of evidence, and yes, we want to move it higher. Let's do more studies and compare it with IVF clinics. And again, this just gives you an idea of our struggle trying to compare with in vitro fertilization, because we're missing a huge amount of data. We were able to document all of our data to say, well, there were this many months, 32 months trying to conceive. 19% of our couples had tried and failed IVF before. 28% had a previous live birth. 30% had a previous miscarriage at least once, and none of that data was available to us to make a comparison with the IVF clinics. Our numbers are small, and there's big data for the IVF, so bear in mind that's also a significant concern when you're trying to draw conclusions. So we're really not comparing like with like, we really are comparing apples with oranges, and we cannot draw firm conclusions, but we can certainly say this is useful benchmarking, and let's do more study so we can draw better conclusions. When we looked at everybody that was age 40 and under, you can see that the live birth rates were comparable, but we've significantly lower cost. Couples often report improved health. They like the individualized treatment and that it's non-invasive. And then again, I mentioned the low incidence of premature birth in twins, and we don't have any issue with surplus embryos. So there you go. Thank you for your time.